Good evening and many thanks for joining us live on QTV. You are watching QTV News and I am Ajipintu Drame. Into our top stories. After 24 hours of chaos as petrol stations refuse to sell fuel, the Gambia government has announced that following negotiations with oil marketing companies, all pumping stations are now open for business. Idrissa Mas Jobe has been re-elected unopposed as the president of the Gambia Chamber of Commerce and Industry, together with a new board of directors. The Gambia Sickle Cell Association on Saturday signed an MOU with NACED, a clinical service provider, to offer quality healthcare services to sickle cell patients. 34 law enforcement officers on Friday concluded 3 weeks intensive training in tackling transnational organized crime and terrorism in West Africa. The Ministry of Health held a press briefing on Thursday to update the public about the ongoing nationwide digital birth and health insurance registration. And in sports news, DBO won the Serekunda Sports Development Association Super Cup final against Bantaba FC in a match that marked the return of the Nawetan season. Those were our main headlines, and now the news in detail. Now, following 24 hours of misery and chaos for those relying on motor vehicles to get around, the Gambia government has announced that following hours of negotiations with oil marketing companies over the fuel situation, all pumping stations are now open for business. I'm sorry for that technical problem, but moving on, Idrissa Mas Jobe has been re-elected as the president of the Gambia Chamber of Commerce and Industry at the GCCI annual general meeting held on Friday. Jobe and the new board of directors, who were elected unopposed, have pledged a leadership that will further strengthen the GCCI and champion the cause of business. Mobru Laminchoy reports.
The Gambia Chamber of Commerce and Industry, GCCI, held its annual general meeting on Friday. This time, the AGM comes at an election time for its president and board of directors. The current president, Idrissa Mas Jobe, presents his activity report, highlighting a long list of programs and projects the chamber rolled out during his tenure.
We have done a lot of partnership with the Roots project. It's a big project. We were able to have the voice of the micro, medium, small businesses represented.
This is followed by the presentation of the auditor's report and financial statements for the period ended 31st December 2021. The auditing was done by PKF, an international accountancy firm that has an office in the Gambia. Natasha Roberts reads out the auditor's report on behalf of PKF.
The Chamber had a net increase in funds of 9,660,000 during the year as compared to 175,000. This is as a result of increase in funds from fundraising activities that did not exist in 2020, and increase in funds from levies and other income. That is from 13 million to 18 million, with the fundraising activities, which will give up the total of almost 9 million.
The meeting has a large representation of members of the GCCI from the Gambia's business community to attend the AGM and take part in the election. 9 positions are up for grabs, including that of president and vice president. The election is chaired by Abdoulaye Touré, a former GCCI president and member of the Chamber's Advisory Council. All the candidates are returned unopposed, marking the re-election of Idrissa Mas Jobe as president for a second term. Having been elected, the GCCI president shares his ambition for his second term.
So we will continue on the same scheme. Another thing that we want to do this time is to lobby the government for the indigenization of the economy of the Gambia. We think that is very important because it is only indigenous business through local employment that can bring about real development. We said private sector-led development, but we want to change that to mean local private sector led development, because the local private sector will employ local people, create local jobs and local value addition.
The Vice President-elect Alhaji Conte shares similar ambitions for the GCCI and the development of local business in the country.
First of all, for me, I would like us to work with government to make sure that anybody who comes, any foreign company that comes into this country must work with a local partner. This is what is happening in all the countries in Africa. It's only Gambia that you can see a foreign company can come and work in the Gambia with no Gambian participation.
Over the years, the Gambia Chamber of Commerce and Industry has taken up programs and projects promoting business and the socio-economic development. Most notably are the establishment of its own trade fair ground and the hosting of a telethon that helped raise funds to support the Gambia's fight against COVID-19. Mahmoud Lamin Choi, QTV News.
The Gambia Sickle Cell Association on Saturday organized a sickle cell awareness forum under the theme Sickle Cell and Lifestyle. As we hear in this report by Aliou Cisse, the association signed an MOU with NACED, a clinical service provider, to offer quality health care services to sickle cell patients.
Dubbed September Sickle Cell Awareness Month, the event, the first of few to follow during the month of September, is meant to raise awareness on the sickness and to interact with sickle cell patients in the country. The association plans to organize a similar interface in Keneba on 17 September. Sickle cell is an inherited blood disorder that shortens red blood cell survival, causing anemia, often called sickle cell anemia. Many public health facilities lack the services for prevention, early detection and care for sickle cell disease. Aliou Sambu, president of the Gambia Sickle Cell Association, praised sickle cell survivors as warriors for their courage and paid tribute to those that died of the sickness. He said the association is pushing for more partnership to effectively implement their programs.
We are all destined to be warriors. It is not our choice. It is destiny that chooses us. And we cannot deny destiny. It was made. And sickle cell is not a cost to us. It's a blessing.
Mamadou Gassama, health promotion specialist at WHO, applauded the Gambia Sickle Cell Association for organizing the event, while giving the assurance that the WHO, in collaboration with governments, prioritizes the welfare of sickle cell patients. Gassama described the sickness as one that required holistic approach in strengthening the health sector and advocacy to raise more awareness.
So all I can tell you is to continue working with, explore as many opportunities as possible with other organizations, with other institutions. The Ministry of Health is there, the World Health Organization, we are there. We are really ready to work with you. What I'm saying, we, the Ministry of Health and the WHO, we are the same. We are the same because our interest is to make sure that the population's health is improved.
Dr. Mamadou Bella Diallo, a medical doctor at Edward Francis Sumo Teaching Hospital in Banjul, used the event to dispel some misconceptions surrounding the sickness, such as the mode of transmission.
I just want to tell you one thing about sickle cell is that every sickle cell patient is unique. The disease itself may be called sickle cell, but each and every patient with a sickle cell may present in a unique way. This is one thing that we all have to know. It's not determined by your SS. We may say majority of people with SS will have this problem, but there are people that are with SS, they are stable, some with AS, yet still they have the same problem.
At the event, the Gambia Sickle Cell Association and NACED, a clinical service provider, signed a healthcare partnership memorandum of understanding. In this MOU, NACED will offer quality healthcare to sickle cell patients at the comfort of their homes or workplace at affordable cost. More than 66% of the 120 million people affected by sickle cell in the world live in Africa. In the African region, 38,403 deaths from sickle cell disease were recorded in 2019, a 26% increase from 2000. It is for this reason that last month, African health ministers met in Lomé, Togo, where they launched a campaign to raise more awareness on the disease, which continues to receive inadequate attention. Reporting for QTV News, I am Aliou Cisse.
Moving on, 34 law enforcement officers concluded a 3 weeks intensive training on Friday in tackling transnational organized crime and terrorism in West Africa. The training is part of the West African Police Information System WAPIS program implemented by Interpol and funded by the European Union. Omar P. Jallo attended the event and he filed in this report.
The program seeks to improve the capacity of West African law enforcement agencies by facilitating information sharing. Lamin Bajinga, the director of WAPIS Gambia, said the program targets all West African countries, including the 15 ECOWAS member states and Mauritania, to combat transnational crime and terrorism.
The objective of the project is to have a positive long-term impact in every member countries. That is to strengthening the capacity of law enforcement agencies of ECOWAS countries and Mauritania to collect, centralize, manage, share, and analyze police information.
Jere Sambu, the WAPIS lead national trainer, said the training of law enforcement personnel for use of the WAPIS system will be a continuous process for effective utilization of the system.
Security is very expensive, but it's easier when we have adequate information to combat crime. So with this system, it avails us opportunities to share information within the various security actors.
Pateba, the Deputy Commissioner of Police and the WAPIS project's single point of contact in the country, said no country or law enforcement strategy can overcome the threats of transnational organized crime and terrorism without an effective exchange of police information.
All of you will be installed with these machines. They are yours. They are ours. We requested for it. Let's take care of them. Let's not use them as status in our offices. Let's feed them with what they are required to get. Feed them with information.
Jibril Law, the Deputy Permanent Secretary Technical at the Ministry of Interior, reveals that as a priority, the Gambia has now established regional liaison officers in all 7 administrative regions to receive and share information.
We can have systems, or we can have supercomputers that can process within nanoseconds, beyond the imagination of human being. But if those performing those activities are not efficient, they are not willing to do the operation as expected, the system is bound to fail.
Representing the Inspector General of Police, the Assistant Commissioner of Police for KM4 SK Balajo, said following the launching of WAPIS in October 2021, the system now covers all the major police stations and drug law enforcement agency stations within the Greater Banjul area, adding that the Inspector General of Police has identified a permanent site for a modern security installation that will accommodate the National Central Bureau for Interpol and the WAPIS Data Collection and Registration Center.
I challenge all of you to make best use of the knowledge you gather from here, and I'm sure you're going to do it.
Samuel Mendy, a participant who delivered the vote of thanks, challenged his colleagues to use the knowledge gained in their respective units. 12 out of the 16 countries in West Africa sit on the Atlantic Ocean, making the region especially attractive to criminals as a transit hub between Africa, Europe, and the Americas. Improving security in West Africa is therefore a global interest and essential to combating the crimes currently affecting the region, such as drug trafficking, people smuggling, human trafficking, and terrorism. Reporting for QTV News, I am Omar P. Jallo.
And from that story, we will go for a commercial break. Still to come, we have more stories to stay tuned.
The Ministry of Health, in collaboration with partners, will be embarking on an other countrywide COVID-19 vaccination campaign from 11 to 28 August 2022. Vaccination teams will be deployed to public places such as community bantabas, health facilities, schools, markets, crossing points, and other strategic locations. All eligible people aged 12 and above are encouraged to come out and be vaccinated. Vaccination teams will be administering 3 types of vaccines, namely Johnson & Johnson, Pfizer, and Sinopharm, all of which are safe and effective in preventing severe COVID-19 infection, hospitalization, and death. For more information, call the ministry's toll-free number 1025.
growing GSM company in the Gambia. QCell has the widest 4G plus coverage in the country, 3 times faster internet speed than our competitors. So switch now and dial *335# and enjoy what true 4G feels like. QCell, the Gambia's trusted network.
Welcome back. Now, 38 personnel from the Army, Police and Immigration Department have successfully completed 2 weeks training on gender in peace support operation to enhance their capacity in integrating gender in peace support operation. Aliusise reports.
Entitled Gender in Peace Support Operation, the 2 weeks training for these selected personnel from the Army, Police and Immigration Services was organized by the British Peace Support Team Africa in collaboration with the Gambia Armed Forces. Dr. Sela Kingoro, Senior Gender Advisor, British Peace Support Team Africa, gave a highlight of the course, which is believed to have widened the horizons and understanding of the participants on gender-related issues.
We had 6 modules that covered various basics, focusing on the peace support environment with a specific intent to identify how gender can be mainstreamed within the various functions, be they military, police, or civilian, within theater. It was facilitated by 5 subject matter experts, 2 of whom are Gambian, and we also were privileged to have 3 facilitators from our last course. We ran a similar course in May this year, and 3 GAF officers helped to facilitate this session.
Deputizing for the Chief of Defense Staff of the Gambia Armed Forces, Colonel Musa Traoré, the military assistant to the Chief of Defense Staff, expressed appreciation to the British Peace Support Team Africa for providing the funding to conduct the training. He urged the participants to make the best use of the knowledge gained, as he gave an assurance of the Gambia Armed Forces' commitment to organize more capacity building programs.
Peace support operations are usually conducted in heterogeneous communities that have people who have different needs, priorities, and resources. A careful study and analysis of the communities indicates that the most influential factors affecting them in meeting their needs is their gender. Therefore, understanding the gender dimensions of armed conflicts would enable peacekeepers to better understand the conflict and the communities that you'll find yourself working in.
Sergeant Maimuna John, on behalf of our fellow course participants, commended and thanked the leadership of the Gambia Armed Forces for the foresight in organizing the training and said the knowledge gained will be useful in their work.
We have learned new ideas, and this has enhanced our knowledge in analyzing how men, women, boys and girls are affected in a society, especially in a conflict environment. The factors responsible for those suffering and possible solutions. The power work practical lesson was the highlight of this course. This has given us a clear picture how people are affected on their population, on their political, economic, and social status, as well as their gender.
The closing ceremony, moderated by Lieutenant Colonel Lamin K. Sanyang, Director of Press and Public Relations at Gambia Armed Forces, was also attended by the Director of Training at the Gambia Armed Forces, Lieutenant Colonel Umar B. Bojang. Participants were awarded certificates on their successful completion of the course. Reporting for QTV News, I am Aliusise.
The Ministry of Health held a press briefing on Thursday to update the public about the ongoing nationwide implementation of the digital birth and health insurance registration and clear unfounded rumors circulating about the process. More in this report. It has been over a month since the implementation of the nationwide digital birth and health insurance registration, and this will be the final briefing relating to this campaign. Modou Njai, Director of Health Promotion and Education, says the turnout has been impressive since the outset of the registration. Mr. Njai also took the opportunity to clear certain public misconceptions about the process, which he described as causing fear and panic in people.
If we don't go for registration now, when the teams leave your area, they will not come back again. And if you have to get the birth certificate, you're going to pay like $500, $1,000, or even up to $1,500. That's what many people are now telling other people, and they are confusing them. And they're making them to rush to the sites, and they're also making them to spend almost all their time in the locations that they are supposed to be. And this has really caused a lot of panic and confusion and fear among the general public. And we want to assure the public, as long as that information is not coming from the Ministry of Health, let them regard it as false.
Lamin Fati, the Registrar of Birth and Death from the Ministry of Health, gave the statistics of the registration turnout and addressed allegations of eligibility to register for both the birth and health insurance registration.
I've registered 162,000. 527 had been registered. And those whose registration are slightly pending because of documentation is incomplete is 21,466. It is totally free of charge. We're giving it to all eligible individual Gambians born in the Gambia or resident born to Gambian descent. If you're born outside the Gambia, to a Gambian parent, you are also entitled to be registered and be given a birth certificate. If you are born to non-Gambian parents and born in the country, you are also entitled to be given a birth certificate. Refugees born in the country, they need to be registered.
The registration will now move from Greater Banjul to the Fonyis in the West Coast region on Monday, which will last for about 4 days. Mr. Njai pleads with the Alcalo to work with the agents for a successive registration process.
And when they come back now, they'll be going to health facilities. So that the areas they have covered before, the teams will be deployed to those health facilities. So that so that the people around those health facilities now will have the opportunity to have access to the electronic birth registration. That's a strategy.
The registration outreach will be for 3 months through to October, by which time they will have covered all the regions. Ajibintu Drame, QTV News. And now in sports news. DBO won the Serekunda Sports Development Association Super Cup final against Bantaba FC in a match that marked the return of the Nawetan season. This comes 2 years since the popular community football competition was last held at SK Eastfield. Our sports reporter Mobudu Kajaka was there and he now reports.
President Banjul organization DBO are winners of the Super Cup final against Bantaba after Ibundur scored with a tap-in in the second half, which proves to be the winner, Omar Tamba's brilliant run and cross leading to the goal. Earlier in the first half, DBO's Omar Tamba had a shot which hit the crossbar. In the first half, Bantaba could have taken the lead just 20 minutes into the game through a counter-attack. Ibrahim Jawara went one-on-one with the keeper Aliu Jaju, only to disappointingly put the ball into the keeper's hands. DBO coach Ibu Sohna praised his team for the victory.
A great achievement for the team, for me and my colleagues. We have not been playing this tournament for the past 2-3 years. We are back today with a victory. That's a big boost, a big encouragement from the players, from the technical side. And we're hoping to face another final again. We came in just to kill them at once. We wanted to bury them in the first 15 minutes. We wanted to score 2-3 goals. You can see it yourself. But things couldn't work, so we decided to calm down and see their tactics. When we realized that they were playing back three, we said we have to fill our forward and score them.
Bakari Diba, coach of Bantaba FC, says they gave everything, but admitted his opponents, DBO, were the better side.
It's a new team, and you don't expect them to hit the road like really quickly. And I think we've learned so much today. This was our first test. I'll call it our litmus test. We've been able to actually identify a lot of mistakes and errors, and our strategy didn't work, obviously, because the other team were better. But we're looking forward to the next game. I think they played really well. They must have realized what we wanted to do, and they've done their homework really well.
This game marks the return of the rainy season popular community football tournament, Nawetan. It attracts a large fan base because supporters feel a connection to their teams. The Serekunda East football field was closed 2 years ago for GFF renovation work. The pitch is barely playable, and it's hard to see what work has been done on the playing surface. The pitch is not even leveled, and there are holes in parts too. However, the venue does have renovated perimeter fencing and dressing rooms. Umudu Gajaga, QTV News.
That's all for this edition of the news. Thank you for watching.